Yeah, no, it's a very important topic. So for the longest time, we've focused on older age in the context of Alzheimer's disease and memory forms of the disorder. But particularly, there are individuals who will develop the disease and cognitive problems, so problems with thinking, perhaps outside of the area of the memory disorder, less than the age of 65. And these are individuals who are working class, they are caring for their children, and so it's a very important population to study. So one of the important things that we can do is we can look at the brain tissue. So we have a brain bank where people have lovingly donated their tissue. And this gives us the opportunity to look specifically at the memory center and the outer cortical areas. And this in particular gives us a lot more information because the younger individuals develop almost twice the amount of tau pathology and even amyloid pathology. But what's interesting is they actually develop it in different areas. So they tend to develop it more in the cortical areas, so they'll present more with apraxia or visuospatial difficulties rather than the traditional amnestic memory predominant areas. So originally when I started to approach Alzheimer's disease, I recognized the importance of understanding the heterogeneity. So an individual doesn't always experience Alzheimer's disease the same way, especially when they are younger. So the initial work sought to subtype Alzheimer's disease into 3 subtypes, but more recently what we've been able to do is to understand where the tangle pathology, where the tau pathology exists. We can now create a quantitative score. So this quantitative score, the corticolimbic index, gives us a sense if the individual has much more cortical pathology, so the more cortical predominant, or much more limbic pathology, more limbic predominant. But now it's on a score from 0 to 40. And the importance of quantitation is then you can compare it with important features from when the patient was living, and especially when the patient comes into clinic. So at the time of clinic, you can ask about age onset, family history. You could look at more important risk factors like APOE E4. But in particular, how do those relate? And so using that quantitative score, we can look at variable importance, and age onset over and above was the most important feature that really predicted basically this cortical predominant phenotype. So the corticolimbic index, with this quantification, we can actually compare it from a relationship standpoint. So the individuals who have a lower CLix score, so they have much more cortical pathology, are younger. They tend to be more male. They have a lower frequency of APOE E4, which is pretty important because those are 3 features that kind of goes against the dogma of Alzheimer's disease. And so in comparison, the individuals with a higher CLix score, this higher corticolimbic index, who have more limbic features, are older, more often female, and have a higher frequency of APOE E4. And there's other more nuanced information that's quite particular and may suggest some glial disturbances in the individuals with the lower CLix score. We always try to ask ourselves is why. We look down the microscope as neuropathologists, we'll characterize tangles and plaques and look at their distribution, but in the sense that's the final outcome. And so we try to step more and more back to see what might be contributing. So we have a tiny little blue spot called the locus coeruleus, and that's our noradrenergic hub. And there's some suggestion, although we're currently working on the data, that the individuals who are younger may have greater vulnerability in this area. And why that's important is even though it's this tiny area, it projects all throughout the brain. So this noradrenergic disturbance may have greater ramifications. We also look at the cholinergic hub, and we've published data on this where the younger individuals that have this more corticolimbic phenotype, so the much more cortical, they have a much greater effect of their cholinergic system, suggesting that perhaps as it gets disturbed, those projections of the cholinergic system may then make the neurons more vulnerable to accumulate the disease pathology.